Hi, this is Arsham Shaybani. This is a case of a patient with complicated cataract surgery and iris prolapse that had uveitis that could not be controlled without topical steroid therapy. The pressure is now rising, and this patient was actually sent in for glaucoma surgery. On ultrasound biomicroscopy, we actually found an area where the intraocular lens haptic was rubbing against the posterior iris. So our plan was essentially to either reposition or exchange this lens. We use iris hooks for better visualization after we release the iris from the anterior capsule. And using a two-handed technique, we actually use a blunted Sinskey hook to elevate the anterior capsule off of the intraocular lens, then inject a dispersive viscoelastic agent. This patient had a prior YAG capsulotomy. What we want to do is dissect the intraocular lens from the capsular bag, but also to coat that posterior hyaloid face or vitreous. And now we're slowly going around the capsular bag and dissecting the capsule off of the intraocular lens. We use another iris hook here temporally where the iris prolapse occurred, and we actually found an area of anterior capsule runout. So that same area actually had zonule weakness or zonule dialysis. We end up rotating this lens now within the capsular bag to move the haptic away from the area of zonule weakness in order to prevent it from folding upwards against that iris tissue. Once the lens is well rotated, we can actually, in the operating room, see that the haptic bulb is no longer visible through that prior iatrogenic iris root trauma or iridodialysis. We now view with the Kugelin hook that the haptic is within the capsular bag. We remove the viscoelastic manually to prevent vitreous prolapse instead of using an automated technique. And once the wounds are hydrated, we inject dexamethasone. And if you look on the picture on the left is preoperatively, you can see the IOL haptic in the capsular bag, however, rubbing against the ciliary body. Post-op, we rotate it and no longer have that issue occurring. However, you can see the capsule is now folded in, demonstrating that area of prior zonule dialysis.